So today's video is going to focus on the top influencers of the cost of dental implant therapy. We know that having dental implant treatment in large metropolitan areas may be significantly more expensive than it is here in our geographic location in Central Florida.
Being in a larger city or a metropolitan area, there's going to be a higher cost of living, which results in higher overhead for facilities. So for an area like Lakeland, being in a smaller town, our cost is going to be lower.
It's not unusual to see a person from the Northeast with treatment plans that are $20,000 more for the same type of treatment that we do here in Lakeland. Traveling outside large metropolitan areas to have the procedure done can save you a lot of money, even after travel cost. And we know, because we have our own in-house lab, that we are better able to control the cost and better able to control the quality with our own smaller, fewer employees in-house dental lab.
We don't have to spend a lot of money on the materials that we use. We have the advantage to be buying in bulk for better quality products. That reduces the cost on the prosthesis itself. So that saving can be passed on directly to the patient, and that's phenomenal.
You see, an outside dental lab is going to be working for maybe 50, 60, or 100 dentists. They'd have multiple employees. Their overhead is going to be a lot higher, and that will all be passed along to the dentist who sends work to the outside dental laboratory. Therefore, operating an in-house lab is not only more cost-effective, but can also be an indicator of how much experience the practice has in placing implants.
The first question that you need to ask yourself when deciding what route for dental implants that you want to choose is, do you have a few single teeth that have some problems and you want to go the single implant route, or are the majority of your teeth in bad shape and you want to look towards a full mouth solution restoration?
There are many different types of dental implant systems, and whether you need one implant or a full mouth restoration will determine your base cost. So what we know is that some offices charge by the implant. In other words, there would be a fee for the implant and then a separate fee for the crown. Other offices charge a flat fee, which includes the implant and the crown. Some doctors, when doing full mouth therapy, charge by the implant, and other offices, like ours, charges by the jaw. In other words, there's a fee for the upper jaw, regardless of how many implants are placed, and likewise for the lower jaw. Not many people do business that way.
A benefit of having a fixed price is during surgery, the surgeon can make decisions medically that won't be surprising to you after the procedure.
Once the treatment is done, when do you see me again? Is that included in the cost? How often do you see me? Is that included in the cost? If I'm out of state, can you help me find somebody? All of these are very particular questions that you should care about, because this is a major investment that you're making for yourself.
So once you know what your end game is and what your desired goal is, you need to be aware of the fee schedule, how it's structured, so that you know what you're getting into before you do the treatment.
Bone grafting is a surgical procedure that utilizes materials to replace missing bone in the jaw. This is a common practice in dentistry, and many dentists are trained in this procedure. However, the bone grafting process can be very lengthy, requiring 3 months to 2 years for more bone material to be added and fused with the jaw. Surgeons with advanced training and experience often use a technique of placing longer implants into the cheekbone, known as the zygoma, instead of the jaw. Zygomatic implants can be placed in a single surgical procedure, making bone grafts unnecessary. This is an ideal solution for patients with severe bone loss. New Teeth Now surgeons place these specialized implants on a daily basis. These techniques will bring up the cost of dental implant therapy. And when you eliminate bone grafting, you're saving time and complications with implants. The success rate is much lower with bone grafting. Zygomatic implants have a very similar success rate to traditional implants.
There were approximately 20 surgeons in the entire United States, not the state of Florida, the entire country, that place the zygoma implants on a regular basis. You definitely have to have skill. You have to have practice to do that. Doing this type of procedure, you want the best. So you want somebody who does this day in and day out.
Would you rather have a surgeon who has gone through years of schooling and training specifically to place implants, or would you rather have a general dentist who's maybe done a weekend course or a week course? They place implants a couple times a month maybe.
How many implants did they do? How many full mouth restorations do they do in a year? How many have they done over the last 5 years? You could find yourself in a situation where you have shoddy work. It has to be repeated later by a more experienced surgeon.
Not all oral surgeons have equal levels of certification and experience. Some less qualified doctors may resort to lowering their prices in order to attract new patients. Patients need to ask, what are the quality of materials used? That is going to determine a large portion of the cost.
The implants themselves, the material from which they are made from, they're titanium. They're what your body is made to adhere to. Hip replacements, knee replacements.
Here we have several restorations. We have about 3 or 4 different materials here. Now this is a denture, just a plain old, all acrylic, all plastic denture. Now another type of acrylic prosthetic, this is a temporary set of teeth that would go on implants, and this is a lower. You can see there are 4 black holes there, and those are the 4 holes where the screws would go through to attach the teeth to the implants. So this is the same material as the denture, it's just a different application. But for instance, if this acrylic prosthesis is going to be your final teeth, then it should cost less. Now what you have to understand is that acrylic is not going to stand up to the test of time, which moves us over into the world of zirconia. We have 4 examples. One of the reasons we have 4 examples is we can show some of the color differences that are available. All of the pink gum tissue is baked porcelain onto this zirconia framework, and these are the 6 cylinders that interface with the 6 implants. This is an upper, and you can see there's no palate. We come back to the denture, you can see that the palate's fully covered, and so this is the difference in an implant bridge type situation versus a denture. But you can also see the difference in the gum color. This is all custom work. These types of prosthetics are not ordered, in size 3, 2, and 1, so to speak. It's all custom based on the person's each individual implants, how many they have, and where they're placed. Because the higher end zirconia stuff is going to cost more than the lower end acrylic materials.
So I've had patients to ask me, well, Debbie, I can get this procedure done in Mexico, Costa Rica. Have we had patients to do that? Absolutely we had.
But the frustrating thing is that when we see these people, they've already had the treatment, and most of the time they're having problems. And when they have problems, they don't want to get on an airplane and travel back to where they had the treatment. So it's buyer beware if you're going out of the country for dental implant treatment.
Getting everything in writing is extremely important. What quality of the material are they using? What does the follow-up procedures look like? What happens if something goes wrong? How are they going to fix that situation? You need to have a plan in place if something does go wrong that you will be taken care of.
General anesthesia is the ultimate safest way in terms of time to do the procedure, in terms of protecting the viability of the bone, in terms of protecting the person's airway so that no foreign objects drop down their airway. Your local anesthesia typically is included in the cost of, let's say, a single tooth implant, where it really would make sense to place a person under general anesthesia to do a single implant, although a lot of people select IV sedation with local. So when you get into the IV sedation, the cost is typically by the hour, and the cost for IV sedation and the cost for general anesthesia at our center is really about equal.
This is a true general anesthesia and a true operating room delivered by either our CRNAs or our in-house anesthesiologist. So those are very important factors that everybody needs to be aware of.
So local anesthesia is going to be the ultimate cheapest, whereas your IV sedation and your general anesthesia are going to be very close to one another in cost. If you're all in one facility, where that facility has the surgeon, that facility has the anesthesia department, the facility has the restorative dentist, the facility has the in-house lab, that's going to be the situation that you want to get into when you're doing complicated full arch restorations. That's where you're going to not only get the best treatment, have the chance of getting the best treatment outcome, but that's also going to be the situation where you're going to have the lowest cost.
Thank you for watching. We hope this has helped you make a good decision on your dental implant procedure.
Thank you for watching. Please click subscribe to see more inspirational and informative content from New Teeth Now.